One issue has dominated so much of what Americans have thought, said, and read for the last few weeks.
We've not received a single test kit.
And we were not able to get them a test.
They actually said, we don't do coronavirus testing here.
This is causing a lot of distress in our county.
The supply chains are stressed. Human beings are stressed.
And I think that was really frustrating and frightening for everybody.
Testing is a crucial part of slowing the spread of any viral outbreak. So why were coronavirus tests so hard to come by for so long? Let's go back to the beginning of the pandemic. Doctors in Wuhan, China noticed cases of pneumonia from an unknown cause in early December.
武汉市部分医疗机构陆续出现不明原因肺炎病人，通知要求各医疗机构要及时追踪统计救治情况，并按要求及时上报。
They saw evidence of it spreading between people, but Chinese authorities didn't inform the World Health Organization of the mysterious virus until the end of December. Researchers worked quickly to try to understand it.
Ask if they can give us the genetic sequencing of the novel coronavirus.
Once the virus's genetic sequence was publicly available, labs around the world rushed to design a test.
In the US, as we typically do, the CDC tried to develop their own test, and that in and of itself didn't have to be a problem.
The CDC weren't the only ones in the US attempting to develop a test. Researchers like Alex and Keith from the University of Washington Virology Lab were also working on their own test.
As we're working through developing this test, right, that we've started back in January, it's starting to work, and we're testing it on artificial materials.
The first case of China's new and deadly coronavirus has been reported here in the U.S.
On January 20th, samples were confirmed by the CDC in Atlanta that, in fact, he carried the novel coronavirus.
Days later, President Trump first commented on the situation.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Per CDC guidelines, only certain people qualified for tests, including those who had been to Wuhan, China, or who had come into contact with someone who tested positive.
It seemed to me like it was this weird catch-22 where you could only get a test if you've been in contact with somebody who tested positive, but since they weren't doing tests, there was no way that people could actually get tested.
Health and Human Services Secretary Alex Azar declared a public health emergency, and the administration announced it would bar some foreigners who had recently visited China from entering the country. But generally, officials continued to downplay the threat of the virus.
I want to stress, the risk of infection for Americans remains low. And with these and our previous actions, we are working to keep the risk low.
The Food and Drug Administration implemented strict rules on labs developing tests to ensure that bad tests were not distributed. Initially, the FDA only gave permission for some state and public health labs to test, and for the CDC to make and distribute tests. Days later, CDC shipped 90 test kits to those qualified labs.
The CDC's test kits are now available for order from the International Reagent Resource for qualified laboratories.
The catch-22, which was intended to keep test quality high, is that this strategy made it difficult for hospital, private, and university labs. Remember Keith and Alex from the University of Washington?
And so the test looks like it's working great.
They finished developing their test, but they couldn't use it. They would need FDA approval to do so. And that required having a sample of live virus, which they couldn't get.
Alex starts these conversations with the FDA, and the feedback was, well, you can't use the test until you test it on virus, which of course, think about it, we don't have, right? So, okay, where can we get the virus? Well, you're not allowed to have the virus because it's dangerous. And okay, then we're asking, what can we do?
That's when the exact thing the public health officials feared happened. There were problems with CDC's test.
A manufacturing problem with a test can always happen. That's always a risk. What made it so consequential in this case is that we put all our eggs in this one basket, and the basket was really important and it broke. We had trouble fixing it.
Now it's mid-February and it's clear that the virus is spreading around the world. South Korea has tested thousands of people. The US has tested hundreds. And that's a huge problem. But Trump gave no indication that he saw a storm on the horizon.
But we're in great shape in our country. We have 11, and the 11 are getting better.
Even after the CDC knew the test didn't work, the FDA didn't loosen regulations on who else could make tests and how those tests would be made.
You can imagine how frustrating this was for us through February when we really knew we had something to contribute, and we were having a really hard time just getting the right approvals and being allowed to do this.
During the delay in testing capabilities, the administration and the CDC assured the public that progress was being made.
We're deploying the full force of the U.S. government to protect the health and safety of the American people. And, one of the things that we did, the CDC, within a week of getting the genetic sequencing, developed a test.
Local officials started to wonder where the tests were.
We were first contacted by the New Jersey Department of Health. They indicated to us that the federal government would be supplying test kits for the state of New Jersey, and that they would be distributed to the counties through the Department of Health. None of those promises from the Trump administration came true.
The number of confirmed cases increased and public panic grew. But doctors were still restricted in who they could test.
We heard that epidemiologists were estimated that several hundred patients had been infected through community transmission in Washington. And at that time, we were still using, the very restricted CDC guidelines to decide who was going to get tested. I think, for physicians all over the world, it feels like we're like at the beginning of a horror movie and we're trying to tell people what's coming.
Even as doctors became more frustrated, it was near impossible to tell what was happening from official statements. Some senior officials attempted to reassure uneasy stock markets and the public.
Secretary, I'm out of time, but I'm told that the diagnostic doesn't work.
That's incorrect. That is simply flatly incorrect.
We have contained this. I won't say airtight, but pretty close to airtight.
You may ask about the coronavirus, which is very well under control in our country.
But others had a more grim assessment of what was happening.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen.
Facing mounting challenges, the FDA loosened its restrictions on February 29th, making it easier for highly specialized labs to develop their own tests.
So, we kind of worked through all this, got a pathway that would allow us to have our tests actually be approved. But before that RNA ever actually made it to the lab, the virus made it to Seattle.
By the beginning of March, there were more tests, but it was still nowhere near the level that the government had promised. Testing centers were not evenly distributed around the country, and it was often unclear how to get tested.
Since we're so low on coronavirus tests, you essentially need to get recommended by your primary care provider, but more so than that, they needed to get state authorization to get tests, order a test for you.
We've been scrambling to find those labs with tests. There's an incredible shortage. We have 3 hospital systems in Camden County. We speak to those systems each day. They've just been able to get their hands on some tests within the last week, and they don't have enough tests.
Trump again tried to reassure people that the tests were coming.
Testing and testing capabilities are expanding rapidly, day by day. We are moving very quickly.
It's clear that effort fell far short. the US went from 11 confirmed cases to nearly 100,000 in a matter of weeks. Still, in comparison to other countries, experts say the US is behind in its efforts to test, a fact that can at least in part be attributed to the failures in the administration's ability to cut red tape. The federal government failed to pivot, adapt, or respond at several critical points. The president spent nearly 2 months issuing confusing and contradictory signals, leaving the bureaucratic machine of the US government to chart the course for the response. The FDA picked a conservative testing strategy, and the executive branch did nothing. When the CDC test failed, neither a new strategy nor a new test were available for more than 2 weeks. By the time the government changed course, the virus was out of control. Now, it's not just the number of tests that are the problem. It's getting the materials to do the tests and the personal protective equipment for providers to give those tests. That means we may never have a true count of how many Americans contracted the virus. If there are statements you've heard politicians say that don't quite make sense at rallies, state fairs, in That One Friend's feed, let us know. Send us a note or a tweet with what they said and your question. We'll check it out. You can follow along by subscribing to the Post YouTube channel and watching more Fact Checker videos here.